Name is Sitawa Wafula. I am a poet, a blogger. She cuts her dress a little more shorter, wears it a little more tighter, and to get a little more into the mood, she pushes the needle a little more deeper. And I run My Mind, My Funk, which is a mental health support and information hub. I started this project because of my personal experience with sexual violence and living with dual diagnosis of epilepsy and bipolar. After I was diagnosed with a mental health condition, I tried getting support, I tried getting help. I had to drop out of university actuarial school because I got none of the above and medical support was way too expensive. So I thought, where do people go when they have mental health issues? Who do they talk to? And I saw one of the key things was lack of awareness. So what we basically do is provide support in form of linkages with people who provide mental health services. So I have a couple of psychologists from around the country who I work with. Some of the challenges I've personally experienced and people I've worked with, basically the stigma associated with having a mental health condition. And you'd find people getting either into relationships or starting a job without ever disclosing about their mental health status, because they know once they do that, it's subject to a lot of stigma and discrimination. And she wishes she would have told someone a little more earlier, but she was a little more scared. So personally, I've been fired from a job, and this is based on my epilepsy. So one day I fell on a client, and I think that was the last day I was ever employed. That was like, I'd say 5 or so years ago. Don't judge her yet, for she was once a little more like you and me. Also, being in relationships, it gets really tricky because you try your best to look quote unquote normal, but at the end of the day, your illness catches up with you. So you're left with this dilemma of when it's too soon to say you have a mental health condition and when it's too late to say you have it. The first thing you should do is get proper diagnosis, and then once the doctor gives you proper diagnosis, then you'll be able to work on a treatment plan. Sometimes it involves medicine, other times it's just going and talking to a psychologist, and then from there now you'll be able to accept yourself, and if you can accept yourself, then it becomes easier. I don't say it is easy, it becomes easier for you to tell your friends and your families about what you're going through. Also looking at therapies, so I do art therapy, I do writing therapy. I know there's something that is nowadays being called ecotherapy, where you just sit around nature and there's just some therapeutic feel that someone goes. So it's a cocktail of things that you do to get well. If anyone out there is going through a tough time, the first thing you need to do is not bottle it in. Look for a release. Alcohol and drugs are not a release, as many people run to those. Suicide is also not a release. So look for a release, either write it down, get someone that you feel comfortable with to tell. Pray if you're spiritual, take a walk, but do not bottle what you're going through, because once you bottle it in, then it explodes into something really big. And this I can tell you from my personal experience. I didn't tell anyone when I got raped, and I attribute my mental health condition to that. Part of her past that she would like to forget a little more for. She would like to be a little more of who she was.
Well, you heard that fascinating story. And guess what? We've got Sitawa Wafula right here in studio with us. She, of course, is a founder of My World, My Mind, I beg your pardon, My Mind, because that's what we're talking about, My Mind, My Funk. Also with us is a consultant psychologist, and that is Dr. Catherine Siengo Mutisia. Welcome to both of you, and thanks very much for joining us on AM Live this morning. So much to discuss about a topic that perhaps isn't maybe given enough attention. Let me start with you, Doctor. When we talk about mental health, what does that mean? What is mental health?
Okay. First of all, I need to correct, I'm a psychiatrist, not a psychologist.
I beg your pardon, yes. There is a difference.
When we talk about mental health, we talk about general well-being, where a person is able to realize their potential, and somebody is able to adjust to daily stressors, and they are able to contribute to the community. And mental health is not just absence of mental illness. Many people, when they hear about mental health, they quickly think about mental illnesses. So we are promoting mental health first. We are preventing mental illnesses, because we need people to be able to reach their potential, to be able to adjust to normal stressors so that they can fulfill, they can be able to contribute to the community.
What are some of the examples of mental health illnesses?
Mental illnesses are many, starting with the commonest, anxiety disorders, where people worry about general issues. There are phobias. From the next commonest are depression and other mood disorders, like where you have bipolar, you could either go to depression, alternating with what we call a manic episode. We have the severe ones like schizophrenia. We also have drug-induced illnesses, which affect the mind as well. And we also have disorders which start in childhood or childhood disorders. For example, we have what we call ADHD, attention deficit hyperactivity disorder, where we have a child who is either hyperactive or they lack attention. We also have conduct disorders. We also have mental illnesses resulting from general medical issues. Let's say, for example, you have anxiety, but the cause of it is because you have a goiter, which is producing a lot of hormones.
Right.
We also have disorders which are related to medical issues like dementia, like Parkinsonism. So there is a wide range.
The list really is extensive.
Yes.
Sitawa, let me bring you in now, because you are bipolar.
No, I'm not bipolar. I have bipolar.
Right, okay, and this is actually what I wanted to ask you. How does one address it? Would one say you suffer from bipolar illness, or you are bipolar, or you have bipolar? And what's the difference between all three, how you address it?
Okay, so first I'll go with the difference and then how you should do it. So first of all, we normally give the person the characteristics of the illness, and this is part of where the issue with stigma and even acceptance issues for people who've been diagnosed with all the conditions that Tari has mentioned. So the person they're a person first of all,
yes,
and then they have an illness.
Okay.
So you don't tell someone who has cancer that you're cancerous. No, you have cancerous cells in you, but you're not cancerous yourself.
Sure.
Or someone with malaria, I don't know what the word would be, malarian or
but
something.
They have malaria.
They have. So you're a person who has so many other attributes to them, and then you just so happen to have a mental health condition. So you have schizophrenia, you're not schizophrenic. You have bipolar, you're not bipolar.
I think that's a big misconception. Many people, I think, don't know how best to address it, but it's very good that you've cleared that up. How did you learn that you have bipolar?
It took quite a long time before I got a proper diagnosis. I know you've already shown my story, so I won't go back to that. But because of the rape, and then I already had that diagnosis of epilepsy, so it wasn't really easy for the doctor to point out, but he always kept saying, we are sure about the epilepsy, but we feel that there's something more. So it wasn't until that when I'd revealed about the rape ordeal, and then that's when the conclusion was because of the unchecked trauma from the repo deal. That's why these are the symptoms are manifesting, and that's when I got the diagnosis for bipolar.
Well, doctor, how do you define bipolar?
Okay, it is a disorder of the mood, and mood is about how we feel. And the reason why it's called because it has two poles. That's why it's called bipolar. You could have a pole of depression where you're feeling sad, you don't feel like interested in things which you normally are interested in, you lack energy, and that then alternates with the other pole, which is we call a manic episode, where the person has excessive energy, they will not get sleep at night, and yet during the day they'll not be tired. They could also become hyper-talkative, they could overspend, they could become hypersexual. So it alternates between high mood and a low mood. Yeah, but the good thing is you could be, there's treatment for it, and you can live a normal life, and Sitawa is a success story.
Well,
she's
indeed, yes.
taking her medication and able to educate other people and live a normal life.
Sitawa, take us through what you experienced, or what you still do experience when you go through those moods.
I started smiling when she was talking of the manic state.
Right.
Overspending is still one of my greatest challenges.
Really?
So, but I really try to have mechanisms in place, like not having all my money together, or having different systems to be able to deal with money
How
issues.
interesting that that is linked to bipolar. One may never put the two and two together, but we'll come to that in a moment.
Yeah, and then also the sleepless nights, so 3 days, 4 days without sleep, and I'm most creative at that time, so I'll be able to come up with really amazing concepts at that time. And as she says, I'm not tired, and I am doing everything at the same time. So I think for me, those two are some of the things that once in a while pop. Depression is still something that I struggle with, especially during the holidays. So when this holiday, I have a self-campaign to be depression-free.
Oh, good luck with that.
I made it today.
Oh,
9.
excellent. Right.
We have 20 more days to go.
Sure, no doubt you'll get through it.
We'll do this, yeah. So those are some of the things I struggle with, but I've been able to also learn my energy, and also, like with the money issue or with the not sleeping, I'd be able to notice, be present enough to notice that I think I bought so many things that I don't really need. So that would make me think about it being something that's coming up, as opposed to be before I'll feel, oh my God, I've already used all this money, I don't have any money. So the next thing will be depression.
Well, Dr. Ari, what can trigger mental illness? We know in Sitawa's case, it was an experience that triggered her having bipolar. Are some people just born this way, or does something have to happen during their life that triggers them?
Okay, when it comes to mental illnesses, they are caused by several factors. Of course, there could be some genetic predisposition, and many people wonder when their loved one suffers from a mental illness, and yet no one in their family lineage has suffered from it. It's just because probably it was there in the background, but there was no environmental trigger to start it up. And that's why we say it is both biological, and it's also can be precipitated by an environmental stress. For example, somebody could be genetically predisposed, then a stressor happens in their life which they are not able to handle, like what Sitawa describes, an abuse, for example, which triggers it.
medication of mental patients. These issues have not been tackled, and so far I've never seen a psychiatrist get a patient out of medicine. So I wanted to ask the doctor whether there are any instances where a doctor will get a patient out of antipsychotic medication.
Okay,
and whether it's legal in Kenya.
All right, thanks very much for that question. We'll address it right now, Daktari.
Yes, thank you very much, Njeri, for your question. And like we had discussed earlier on, that when somebody has a mental illness, especially the severe ones, they might not be able to realize that they have a problem. Now, the Mental Health Act, as it is currently, allows your next of kin to give consent for your treatment if you are not in a position to give a consent. So the law in Kenya through the Mental Health Act allows next of kin to request for treatment on your behalf if you're unwell and you're not able to realize that you're unwell. And as to whether we take people off medication, it depends on the disorder. Because even for the severe illnesses, what we do, we usually would put people on treatment for continuous 2 years for the first episode, taper it down and stop and see whether the illness will come back. If there's a relapse, at least 2 relapses, would advocate take the medication for at least 5 years, let's taper and stop and see whether the illness will come back. Then after more than 3 relapses, we usually advise that it would be safer to continue on long-term treatment. But however, with good social support, we discuss with your family and we can give drug holidays so long as there's a family member or a friend who can easily observe you, and when the symptoms start coming up again, you can be restarted on medication. Okay. So it's very crucial that people realize that sometimes you can be unwell and you don't realize that you're unwell.
Right.
And yes.
All right, Sitawa, how important is it, based on your own experience, for people to be accepting of the situation, to go and see a psychiatrist?
I think the sooner you accept, the easier things become.
But it's easier said than done, isn't it?
It is, yes. So, and that's why we even start from passing information to people who've not yet experienced a mental health condition, so that you're easily able to notice your own energy levels over a given period of time. Some of the symptoms Dr. was pointing out, before it gets to that severe space where and then someone else has sort of to be in charge of your health, your mental health decisions. Sure. So I think, and one of the things that makes it really hard for people to accept is the sort of stigma that surrounds it. Right now, if I got a diagnosis of any other illness, it wouldn't be as bad as if I was told I have a mental health condition. And it's because we say, oh, we see a lot of other illnesses being talked about openly, not just in the media, but even in our small circles at home, in church, in other places. But when it comes to mental health conditions, it's something we want to lock ourselves somewhere and say, oh, by the way, Sita has something, and she's been doing that. We don't want to openly talk about it. So that's part of the things that make it hard for people to accept once they get the diagnosis. They know, oh, I'm going to be fired from my job. My husband or my boyfriend or my wife or my girlfriend is going to leave me. I will not be able to provide for my family. Right. All these things come. So it makes it harder for people to accept. But the sooner you do that, and just realize that's an illness like any other, you adhere to your medication, and also have other support systems, healthy support systems around you, and also therapy, even for Jerry with the question she was asking. If you do it as a combination of things, it makes it easier for the medication to work and easier for you to even get off the medication or have you.
Well, all right. Well, Daktari, how does one deal with somebody that's in denial? Is there anything you can really do? Because if it's an adult, for example, if the family members are seeing a change in behavior and they try and speak to that individual, consider going to see a psychiatrist or a doctor, getting help, and they are completely in denial, it's a lose-lose situation, isn't it?
Yes, sometimes it might not even be denial. It could be that the person cannot understand that you're saying she's unwell. They don't think they're sick. It might not actually be denial, although there are cases where somebody has been given the diagnosis, but they can't accept that they could be having that illness. And there's a lot that can be done, like what Sitawa said, psychoeducation. When you are given facts about this is the illness, this is how it will, the progress, this is how to tell when it's relapsing, this is how to manage it. Just giving the facts can help somebody be able to accept. 2, family education, educating the family and around the friends around them to be able to support them. And particularly something very good are the support groups. We don't have very many of them. We have several users of psychiatric care trying to come up with the support groups. That is a line which needs to be empowered so that people can support others, because it's easy. People will say, you're a doctor, you're saying this because you've never lived this.
Sure.
But when Sitawa talks about it, other people are able to identify with it, and because relate, she is on the medication.
Right.
Yes.
Okay, Sitawa, well, let's talk about pushing for this discussion. My Mind, My Funk, that, of course, is a tool that helps support people that may have mental health illnesses. Tell us more about it briefly, and what more needs to be done.
All right, so we do basically 2 main things. One is information. Our core people that we pass information to are people living with mental health conditions and their families. Mainly, how do you live with a mental health condition? How do you go for a diagnosis? How do you keep regular check-ins with your doctor? And then also for the family, how do you create a good environment? Because someone can even go for rehab, and then when they come back, it's still a toxic environment, and it triggers them. And so a family will be like, we've done everything, we've taken this person everywhere, but we just don't know what is wrong with them. So also providing that information for the family. And then also providing information for the general public. How do you live with, how do you make the environment conducive for everyone, regardless of whether they have a mental health condition, and also conducive enough so that yourselves do not get into getting a mental health condition. So that's with the information. And then on the support side, we ran for 1 year a free SMS line, but we are restructuring that so next year we'll have it back and with more features.
All right.
Yeah, so and through that people would send in from all over the country any issues that they have, and then we'll be able to do referrals for them, because a lot of people don't know where to go.
Sure, okay. And in the meantime, can people still get a little bit of information or contact details from the website?
Yes.
Which is what?
MyMindMyFunk.com.
So www.mymindmyfunk.com.
Yeah.
All right. On the issue of that Sitawa just brought up, people don't know where to go. So, of course, there's information portals out there. Earlier, I did confuse your title. I called you a psychologist instead of a psychiatrist. Of course, you are a consultant psychiatrist. Briefly tell us, what is the difference, and is a psychiatrist the go-to person for somebody who has a mental health issue?
Let me clarify that psychologists and psychiatrists are mental health professionals.
Both of them are.
They help prevent, promote, and treat mental health. Treat mental illnesses and promote mental health.
Yeah.
So the difference is that a psychiatrist is a medical doctor who has specialized in mental health prevention and treatment.
Okay.
A psychologist would study psychology, human behavior. Some could specialize in clinical psychologists. They are very vital as well in the treatment. Both cadres are very vital in the treatment of mental illnesses, because mental illnesses mental illness or disorder is best treated when you have the medication part of it, the psychotherapy part of it. So both of them are very vital.
Okay,
and
all right.
Depending on the severity, sometimes you might just need talk therapy alone, which is psychotherapy. Sometimes you need both, and sometimes, most of I wouldn't advocate for any time where you're on medication alone without talk therapy, because even the psychoeducation itself is very important. Yes, so they are both very vital.
Okay, excellent. Good to know. Sitawa, as we close, I heard you in one of your interviews that you said, I'm not ashamed. And certainly that is the kind of attitude that a lot of people need to adopt. What are your words of advice to anybody, a family member that's perhaps worried about one of their other family members, or someone that perhaps thinks, you know what, I might have an issue and I need to address it?
I'd say the faster, the sooner. we accept what is going on, the easier it becomes. As we've mentioned, it's easier said than done. But just looking for ways, healthy, positive ways of accepting and dealing with our situations, not just because we have a diagnosis, even before we get the diagnosis, being mindful, noticing our energies, taking care of our mentals would be good, because we do an annual physical checkup. We rarely consider our minds. So loving ourselves first, that's what I'll say. Loving ourselves to the point that we're able to notice things are going wrong or things are going right, and appreciating those things when they go right and addressing them when they go wrong.
Okay, and Daktari, your parting shot, what's your advice?
I would say that it would be very good for people to promote their mental health, eat healthy, exercise, deal with stress, manage your stress, so that we can promote mental health, not just to wait and for people to get illnesses and we advise them on how to treat it. Thank you.
Dr. Catherine Siango Mutisia, consultant psychiatrist, thank you very much for joining us on NTV this morning, and also Sitawa Wafula, founder of My Mind, My Funk, a poet, and so much more, a warrior. Thank you very much for sharing your story. No doubt many people have benefited from this conversation, and the conversation must continue. Thanks for joining us on All right, indeed, you are watching AM Live. It's just gone past 9 o'clock on this Wednesday morning. Thanks very much for your company. Before we go, though, let's bring you the names of the winners who correctly answered our question of the day. That was the question, what causes mental health illness? And there you have the